In this episode of Side by Side, we hear from Marion Jones, an NMO patient and passionate marathon runner, as she shares her perspective on shared decision-making.
My name is Marion Jones, and I am living with neuromyelitis optica. I am new to the Boston area. I was born and raised in the South. I do consider myself to be very fortunate living in New England, in Massachusetts, where there are some of the best doctors and neurologists in the country, in the world. And the fact that I was diagnosed here and started on treatment relatively soon after being diagnosed, that is not the case for many people who live with NMO. Shared decision-making, it means that the patient is doing as much research as they can prior to their appointments. They are, reviewing their MRI scans, logging into the portal, writing down questions that you might not really be sure about, leaning on your NMO or your rare disease community for any support with providing additional questions that you might need to ask during those medical appointments. And then when you go in to visit with your doctor, that should be a time where you're not just being spoken to, but it's a conversation where you are getting questions answered, you are getting clarification, and ultimately you're walking away feeling comfortable and that there was some benefit gained from that visit. I will say in the very beginning, one of the things that made me feel as though I wasn't as much a part of the decision-making process was shortly after being diagnosed, I started on a treatment that unfortunately I relapsed on. I don't think I had enough information about the treatment options that were available to me. Had I had more information and more time and maybe more support in the form of just connections to organizations or a community, I would have been able to really look at the options and weigh in on the decision, and maybe I would have avoided relapsing so soon. I was an active runner prior to being diagnosed with NMO and had to go through a period of not being able to run as I was being rehabilitated to learn how to walk again. But in the spring of this year, I started to prepare and train to run my first marathon, and I finished the New York City Marathon in November of this year, and now I'm a marathoner.
Let's recap what Marion said about shared decision-making. Marion considers herself very lucky to live in a region with very good medical support and personnel. If you do not live in a big city with this kind of medical support, please reach out to the Samire Foundation to get connected to a specialist near you. Be active as a patient, do your research, come prepared with questions, and get community support before your doctor's appointment. This is how Marion gets clarification, feels comfortable with her treatment, and gains true benefit from the appointment. Being a new patient means a lot of new information. Marion relapsed and felt like she didn't have sufficient information on treatment. It takes time to learn about your disease, so join our rare disease community to share experiences with medication, doctors, and seek helpful tips from other patients and caregivers. Besides the flood of new information, a rare disease can be hard on your mental health too. A completely new outlook on life is very overwhelming. And anxiety and depression, well, they're quite common. Our TSF community will help you to find support and most likely even new friends. Marion mentions her very active lifestyle as a runner and marathoner, which needs to be considered in her treatment. Think about your lifestyle choices to discuss them with your doctor. To help you prepare for an upcoming appointment, please visit the Samire Foundation's global website to access resources about shared decision-making. The links can be found in the description below. In the meantime, we invite you to share your experiences in the comments below.